I'm going to be doing a head to toe assessment for nursing 320. So first things first, I'm going to go ahead and get my gloves on. So after donning appropriate gloves, I'm just going to start at the head and work my way down. So first things first, I'm going to inspect and palpate the head and scalp to make sure everything is within normal limits. I'm going to check the temporal arteries and the temporomandibular joint. Is there anything hurting? Any pain? Do you have any pain? No pain is noted. Do you have like a sharp or dullness when I touch?
No.
Right. So next I'm going to check the cranial nerve 7, and I'm going to have you raise your eyebrows. Stick your tongue out. Smile. All of the facial symmetry is even. Her smile is even. There's nothing abnormal at all. Next, I'm going to move to the eyes and inspect the external eyes. The conjunctiva and the sclera all appear to be normal. Have you had any recent eye problems?
No.
Has your vision been good?
Yes.
All right. How many fingers am I holding up?
2. 2. 2. 3.
Her cranial nerve seems to be intact, and her visual fields are also good. Follow my finger. Next, I'm going to check the pupils and make sure they are brisk, equal, and reactive, and she has accommodation. Her pupils are 3 millimeters, equal, brisk, and reactive. All right, accommodation is present. All right, next, I'm going to inspect and palpate the ears. Nothing seems to be abnormal at all. Have you had any problems like hearing or anything that you can report that you've noticed? The patient reports that there is no abnormalities with hearing in either right or left ear. Next, I'm going to inspect the external nose and palpate the sinuses. Nothing feels abnormal. All bones are within normal limits and intact. Next, I'm going to check the patency of the nares. The right and left nair is patent and open. And have you had any issues smelling?
No.
The cranial nerve 1 is intact. She doesn't report anything abnormal with recent smells. Next, I'm going to inspect the mouth. So I'm going to palpate the lips. Everything appears to be normal. Can you open for me? The mucosal membrane appears to be normal. There's no dryness noted. They're not pale and white. They are pink, red, and the patient appears to be hydrated. The patient has not had any trouble swallowing or anything recently. Can you swallow for me? Cranial nerve 4, 5, and 8 seem to be intact. Nothing abnormal on the trachea. There's been no recent dysphagia. And stick your tongue out again for me. The hypoglossal nerve appears to be intact. Next, I'm going to move to the neck. Lymph nodes feel normal. Trachea also appears to be normal. How's your range of motion? Patient has good range of motion. Can you go the other way for me? Clockwise and counterclockwise. The thyroid appears to be normal, and patient has no history of any thyroid issues. Next, I'm going to go to the chest and lungs, just inspecting the anterior and posterior chest walls. Patient has equal rise and fall. Her respirations are unlabored. And about 16 estimated on respirations per minute. I'm going to take a listen starting at the right, moving over to the left anterior and posterior. I'm going to have you turn just slightly, a little bit more. Scooch up just a little bit. Sorry. Anterior and posterior lung sounds are all clear in each field. She's moving good air and no abnormalities at all. No tactile fremitus noted either. Patient has a completely within normal limits chest exam. Next, I'm going to do the neck vessels and heart. So patient has no signs of JVD and also no history of congestive heart failure. Her carotid pulses are +2 and within normal limits. I can feel the apical pulse within the front of her chest wall. And then I'm going to go ahead and listen to heart and make sure that there's no abnormalities. I'm going to flip over and also listen with the bell. Heart sounds appear to be normal. There's no murmur or abnormalities noted within her heart assessment. Her pulses are equal and good, and heart sounds are also the normal 1-2 rhythm. Next, I'm going to inspect and palpate the abdomen. So I'm going to have you just kind of swing your feet up here. The camera slightly. Right. Appearing from this view, abdomen appears to be normal. Patient has no previous GI issues and is noting no problems today. I'm going to go ahead and just take a listen to all 4 quadrants. I'm going to go ahead in with some light palpitation and make sure that the patient is not tender in any abdominal areas. Do you have any abdominal tenderness? Patient reports no abdominal tenderness. Go ahead and switch her in here. All right, next I'm going to inspect the upper and lower limbs. Can you take the hoodie off for me? Oh, you have one. So I'm just going to go ahead and put her sleeves up. So first, I'm just going to look for collar. Her skin is warm to touch, pink. Skin turgor is good. The patient didn't look dry in her mouth assessment, so I expect that she is well hydrated. Her skin turgor as well is good. Again, temperature is warm. Radial pulses are +2, normal. Cap refill is less than 3 seconds. Hair is normal within patient. All right. Skin color on legs also appears to be normal. There is no abnormality. Skin turgor is also okay. Warm and pink to touch. Tib fib pulses are +2 and within normal limits. There's no edema noted in any limbs. Next, I'm going to do move to my musculoskeletal. First, I'm just going to have I'm going to inspect. There's been nothing abnormalities up to this point. How's your range of motion?
Good.
Arms?
Yep.
Arms, shoulders are good. Wrists? How about ankles? All right. Go ahead and flex for me. Push down, push back again. Both dorsal and plantar reflexes are strong and equal. Go ahead and hand grips are good and equal. Push away, pull forward, grab me, and pull forward. All strength is normal. You don't report any numbness, tingling, anything in any of your limbs. Okay, perfect. All right, I'm gonna go ahead and have you hop up. Have you had any gait issues at all?
No.
Okay, stand. Go ahead and bend and touch your toes. Great. All right, have a seat. All right. So last, we're gonna move to our neuro assessment, which is always very important. So first things first, we are going to see if we are oriented. So do you know who the president is?
Trump.
Trump. Do you know the day?
December 7th.
Okay. Do you know where we are?
Kevin Clark.
All right. So patient is asking orientation questions well, and I would give her a GCS of 4, 5, 6, 15, and also report that she's oriented times 4. So for our upper limbs, we're going to check our rapid movement. So go ahead and tap my hands. Okay, great. Tap foot on my hands. Just that. Her rapid movement is equal and bilaterally in upper and lower limbs. All right, I'm going to go ahead and have you touch your finger and take it to your nose. Finger to nose, finger to nose. What is this?
A pen.
Patient is asking and describing she's not presenting any issues of being aphasic or disorganized thoughts at this time. She's following commands well. Next, I'm going to check her deep tendon reflexes. Patient appears to have reflexes. Take her shoes off and touch her, try her plantar reflex. Patient has a positive plantar reflex. So next, we're just going to kind of analyze our findings and describe. This patient shows a completely normal, within normal limits assessment. There are absolutely no abnormalities. Patient has no medical history that is causing her any problems or chronic diseases. Today, she didn't report any pain with any palpitation inspection. I would give her a within normal limits, and she is pretty healthy and good. I'll educate her on her smoking cessation because she is still smoking 2 cigarettes in the morning, and give her education on why that is not good and not healthy for her lungs. And I think that we can follow up, and I don't believe that we need any referrals today, as again, it was normal. She had recent labs that were also within normal limits, so I don't think we'll need to repeat those labs for at least another year at her annual PCP appointment. All right, thank you.